Epidemiologist and health economist at the Harvard Chan School of Public Health. Doctor, we appreciate you being with us again. I just want to start by getting your reaction to this milestone, the number of deaths here in America exceeding 100,000.
It's a very grim milestone. 100,000 deaths in approximately 100 days since we had the first death. And it's the most deadly pandemic in 100 years. And so it's very, but we cannot accept this as a new normal, but yet here we are. And if you look at the line, the trend line is still very, very linear going up. It is not slowing, it is not flattening.
You bring up a really good point, which is we've seen a lot of states, more than a dozen at least, beginning the first phases of reopening under those federal guidelines without meeting the criteria of seeing a 14-day trend in downward cases. I guess when we look back at this outbreak over the last couple of months, what do you think we have learned about the coronavirus and the way that it is spread?
Well, I think we've learned that this virus spreads in very unique ways, that the R naught is actually as high as we thought it is, between 3 and 4. There is a tendency for super spreading events, such as a lot of meatpacking plants, nightclubs, as we've seen in South Korea. And it's just, this is very, very hard to contain. Luckily, we will have drugs and we will have vaccines. It just takes time. But during that time, I think we have to just realize we have to fight this much more vigilantly. And the countries that have, like New Zealand, have crushed the curve, while countries like the US have stayed at a very high plateau.
And what do you think when states are reopening? I guess, what is your message to people watching when it comes to what the new normal is and what they should be doing to continue to curb the spread of this virus? Because while it's largely left up to state governors, it's up to everyone to contain this.
Yeah. And I think the key is the more vigilant you are about everything, mask wearing, distancing and not going to pool parties and other, protests in which you're actually spreading it even more. If we are vigilant, we can actually reopen faster and sooner. But the more we actually complain about silly things and fight over silly things like wearing masks, the more this epidemic will keep going. And that is the main worry. I think we can reopen. Capacities of restaurants, everything will be different. Everything we do will be different. But the more we follow public health guidelines, especially masks, the faster we can get out of this. And people just need to see that in terms of long-term goal as opposed to short-term pain.
Dr. Eric Fiegl Ding, we really appreciate you being with us. Thanks for that.